One, live.
Good morning. Recognizing a quorum of commissioners, I call the June 8th, 2023 meeting of the Cannabis Control Commission to order. This meeting is being held remotely pursuant to Chapter 22 of the Acts of 2022 and is being recorded. Commissioners Camargo, Concepcion, Roy, Stebbins, and myself are all participating in today's meeting. All votes taken today will be by roll call. We have a full agenda today that I will generally summarize. We'll start with opening comments from commissioners and approval of one set of minutes. There will be no executive director's report today, so we will then proceed to staff license recommendations. There are several change of ownership applications, 7 provisional licenses, approval recommendations, 1 provisional license denial recommendation, 12 final license recommendations, 75 license renewal recommendations, and 1 responsible vendor training. There are 2 items in the commission discussion and vote section today, a discussion on the next round of topics for regulatory review and a discussion on legislative and executive branch outreach as it relates to veterans' access to medical marijuana. I'll ask that commissioners wishing to comment or ask questions during any part of the meeting raise their hand to be recognized. And with those initial comments, I'm just going to quickly say that the reason we don't have our executive director, Sean Collins, here today is that he has a new visitor, and Kennedy Rose Collins has joined the family. So we wish Sean and Jen the best and know that they're enjoying, hopefully they're enjoying good health and enjoying one another. So we're sorry to be know that Sean's not here, but glad that it's a wonderful event that prevents him from being here. I'm just quickly going to say Happy Pride Month. Very excited to see many conversations that are going on across the Commonwealth. Understand how the LGBTQ plus community involves itself in the cannabis industry. And with that, I will turn over to Commissioner Camargo, who is joining us remotely. Commissioner Camargo.
Good morning. Good morning. Thank you, Chair. And thank you. I was going to say the same thing. It's, happy Pride for all those who celebrate. I know there's a lot going on throughout the Commonwealth, a lot of parades, a lot of events. So I'm hoping that folks get out there and enjoy and understand the true meaning of pride and why we celebrate it. So thank you for that. I also know that Commissioner Concepcion will make some comments a little later. We were able to meet with delivery operators and couriers this past month and really hear the concerns, not just about the 2-driver rule, but some other stuff that that also came to the forefront. So I'm excited for the discussion later on today, Chair, in terms of other regulatory topics that we have to cover, and grateful to be here and appreciate the virtual option to be here today. So thank you.
Thank you, Commissioner Concepcion.
Thank you, Madam Chairwoman. Let's see what. I need to push this.
They can still hear you.
Oh, okay. Well, good morning, everyone. There's so many people in the crowd today. It is good to be here in person for our public meeting. I wanted to echo, happy Pride Month to everyone and congratulations to our executive director. Before we started today, I was telling Commissioner Stebbins that sometimes I don't have a plan on exactly the direction I want to go with my introductions, but the long ride from Boston to Worcester sort of helps me process and think about where we are, where we're at, where I plan to go. So there are a few thoughts I do want to share. So I often talk about the unique role we have as regulators. And it's a role where it is what you make it. You can sort of identify your priorities, push forward, and make sure that we're doing things that follow the intentions of Question 4, the voters, and the Commonwealth. And like a majority of the commissioners here, I am now in my 3rd year of a 5-year term. And I will be really frank, I have no plans on running for office. I have no firm plans.
I'm very disappointed to hear that.
There's no plan. And there's no firm plans on sort of what happens once my term commences. But when I became a commissioner, I was very clear and still remain clear and committed to the fact that I intend to leave both this agency and the industry in a better place than when I started here. And that's by really utilizing our full power to inform and communicate with government officials. And you can see that through our legislative and executive outreach. That's through removing unnecessary and harmful regulations. And I've spoken a lot, and I will speak some more today around suitability, and also ensuring that our equity mandate is met. And with that said, I wanted to highlight a few things that have happened since our last meeting. I know we met about 2 weeks ago, but there's a lot that has happened since then. One being our first annual State of Cannabis event held at the State House. And that is where the commissioners and staff shared important updates on the state of the regulated cannabis industry in Massachusetts and provided an overview about how the commission operates. And it was phenomenal. I really, really want to thank everyone here, all of my fellow commissioners, because we were able to go to Beacon Hill and really walk through exactly who we are, who our staff is, and how we function, and the importance of that. I think that sometimes because there's some distance between Boston and Worcester, sometimes it can feel like we're a little bit distant, but the reality is that communication and that partnership is vital to both our roles here at the Cannabis Control Commission, as well as what happens at the State House. So I just wanted to say thank you to my fellow commissioners. And I also wanted to do a really, really good thank you to Matt Giancola, our Director of Government Affairs, because I know that he has heard me a lot since I became a commissioner. I know that I sort of zeroed in on him and his role and expanded sort of what he does here and making sure that we have this strategy and creating a State of Cannabis event. So I just want to tip my hat off to him because he did phenomenal. And I was so proud of him. I know he's grown, but I was really proud of him, and he'll hear more from me, but I'll give him a break for a little bit. The next thing is tackling suitability. And I think I'll bring this up again later on today when we talk about our regs and our priorities. But I talk a lot about that because it is so important. I don't hide the fact that I am, a Black woman from Mattapan. It's a certain portion of Boston. It's a multifaceted neighborhood, but it's also a neighborhood that is considered an area of disproportionate harm, that has been harmed by the war on drugs. And I think that it's important to talk about when we stop an individual from being able to come into this space and get an opportunity for employment or ownership, that doesn't only impact the individual, it impacts the family, it impacts the community. And I know that firsthand. So it's coming from a place of personal knowledge, and I am committed to completing that work. And I'll hold off on that because we'll talk about that later on as well. And then finally, Commissioner Camargo mentioned this, and I want to reiterate, in March of this year, actually, I brought up the ongoing 2-to-1 delivery driver conversation. And at that point, I mentioned that because it was a matter of public safety and a matter of equity, Commissioner Camargo and I would co-sponsor a conversation and have a conversation before the full commission at a later date, in the hopes that we would include it in the agenda. And we had the opportunity to speak directly to licensees. So we convened a gathering virtually, and we really took that time to speak with them about where they are right now, the viability of the license itself, their concerns. There's an overwhelming, it comes to no shock to any of us here that 2-to-1 driver rule has been a hardship for a lot of the delivery operators and couriers. Couriers in particular, though. But I just wanted to convey my gratitude to those individuals that did meet with us and have that conversation with us. And I will also bring that up later on in this meeting as well when we go through our regulatory conversation. But I want to thank Commissioner Camargo because you have been, I'm looking up, I don't know if you can see me looking at you, but you've been really, really helpful in that conversation, in the suitability conversation, State of Cannabis. I feel like I've been grabbing things from your mind, and I appreciate you. So with that said, thank you.
She looks a little in this room, just so you know, Commissioner Camargo, it's like the Wizard of Oz looking down on us, kind of keeping an eye on everything we're doing. So when we're looking up like that, we're doing it like this. Thank you.
I'm there with you all. I'm there with
All
you all in
right.
spirit.
Commissioner Roy?
Thank you, Madam Chair, and thank you to all my fellow commissioners. And I want to commend Commissioner Concepcion for all the work that she has done around suitability. And also, I want to start by thanking her. It was her idea for us to go up to the State House to the state of the cannabis industry. And I want to thank Matt Giancola, Director of Government Affairs, as well, because what a great day that was. And I'm excited this will be an annual event. So I want to thank you for thinking of it and making it happen. So I'm going to be really brief this morning. I know June is a busy month. There are a lot of celebrations and awareness months, from Pride to Alzheimer's awareness to D-Day at the beginning of the month. But I just want to focus on Juneteenth for a minute, if I may, and also known as Freedom Day. And it's a newer holiday in Massachusetts. And although, you know, it is a holiday and we have the day off, we remember why we commemorate it. And I just want to commend the commission for their mission around diversity and inclusion, all they do. So I just, as we celebrate Father's Day, and it's also the same weekend as Juneteenth, I just wanted to take a moment to reflect on that. This month, I also wrote a letter to the editor in the Boston Herald. I don't know if any of you saw that. There had been a few editorials that had come out from the Herald around accidental child ingestions, and Commissioner Stebbins and I have convened many groups around this, and we actually went out to Western Mass to meet with all the public health officials from all 4 Western Mass counties to put our collective heads together to discuss what we can do to prevent child ingestions. And having said that, though, the commission has stringent regulations in place around child-proof packaging and not marketing colors and cartoons to minors. So the purpose for my letter to the editor was just to let readers and patients and consumers to remind them of our regulations that are in place. We also now endorse shifting gears. The driver's ed curriculum around cannabis impairment. We were the first adult use state in the nation to incorporate this. So very proud of that. It's prevention and education, and it's also, you know, consuming responsibly and safely, and locking your products up safely. So young people, it's up over 1,000%. So it is an issue that does need looking at, and what we can do to keep young people safe. They see a gummy, they don't know that it's cannabis infused. So other than that, I'm looking forward to today co-sponsoring veterans access in medical marijuana with Commissioner Stebbins. I'm excited to have that conversation with my fellow commissioners, and I think that's it. So thank you very much for my time.
Thank you very much, Commissioner Stebbins.
Great, thank you, Chair. And again, I love being last because I can just say ditto, 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 ditto all the way down the line. But I won't. No, I'm okay with this. I'm okay with this. Yes, happy celebration of Pride Month, and the anniversary of D-Day this month, as well as the focus on the dreadful disease that is Alzheimer's. But I also want to offer my congrats to our incredible team, Commissioner Concepcion, for the State of Cannabis event at the State House. Thank Chair Donahue, Senator Gomez's staff. I know he's still on the mend, but their incredible efforts to host this first of its kind event. And again, hopefully it will become an annual trip for our team to go up to Beacon Hill. Thank the research team, communications, Matt Giancola, our lab testing team that was there to talk about some of the tricky issues around lab testing. But I was also encouraged by not only how engaged the staff was that showed up. They followed up, asked questions. They're certainly paying attention to the work of the commission, and that's greatly appreciated. Had a very nice email from a freshman state rep who was there, Representative Vaughn, who has reached out on a couple of occasions to talk about some of the consumer awareness and consumer protection issues that continue to be out there. Secondly, I just want to give a quick update on the regulatory work of the Social Consumption Working Group. We had a survey that went out this week to over 1,000 contacts, primarily targeted to our economic empowerment, social equity applicants, our micro business licensees, and our grower cooperative licensees and program participants. We've already had 400 clicks on those 1,000 surveys, and Those are due back by the end of the month. So we hope that the target audience will take the time to go through, fill out the survey, complete it, share their thoughts and ideas and opinions on social consumption. This is just a note because as all my colleagues are out and about, if you get questions, hey, I got this survey, we want you to know what that survey was.
Did you define who was the audience that you sent that survey out to?
Sure, it went out to economic empowerment program participants, SEP program participants, micro business licensees, and our grower cooperative licensees as well. So those surveys, we'd love to have them back by the end of the month, but please take the opportunity to weigh in now and complete those. And obviously, we continue to also invite broad public comment via email and some listening sessions that we have coming up. So we really want to have a good, thoughtful, thorough advocacy and interest and feedback on this topic. Also want to just say, obviously, I think over the past several months, we've heard of some of our licensees closing their operations. Of major significance is the impact that has on over 100 workers plus across the state. I was encouraged to see on several platforms that other licensees, other stakeholders are taking up the cause to try to raise awareness of where other opportunities might lie for those folks who suddenly find themselves unemployed. There continue to be great opportunities within this industry. And I was encouraged by their interest in reaching out and trying to support kind of their fellow cannabis industry stakeholders. And finally, just congrats to our ED. As a proud girl dad, I can say it's easy that they will have you wrapped around their finger from the first moment that you lay eyes on them, and that lasts. I have a senior who just graduated, and yeah, proud girl dad.
The
So
senior who graduated, who's
Yes.
going to,
Tufts.
who helped us with.
Her class, not her particular class, but the program at Keefe Tech helped with the assessment of the social media messages out there related to driving while impaired. So
So we congratulate your daughter and we thank her for her service to the Cannabis Control.
there you go.
I didn't know she
Thank you.
chose a school. Well, that's awesome.
Yeah, she's excited.
Very good. And Sean's got 18 years to where you got tuition. Enjoy yourself, Sean. Okay. With that, I don't know if anybody has any other comments or bad jokes, which I tend to do too often. So we will begin with the staff recommendations on changes of ownership. Annie DeMary is going to be doing this for us.
Good morning, Chairwoman. Good morning, Commissioners. Today we have 7 change of ownerships for review and consideration by the Commission. The first being BKPN LLC. They are seeking a change of ownership and control over 1 adult use license and are requesting to add 1 individual. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend a review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay, thank you. I don't know if there are any questions and comments for Annie. If not, I will entertain a motion. Commissioner Roy to approve the change of ownership of BKPN LLC.
So moved.
Commissioner Concepcion, will you second that motion?
Second.
Having been moved and seconded, again, any questions or comments? Hearing and seeing none, I will take a call of the roll. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. It is approved, 5 in favor, 0 opposed. Moving to Cannatech Medicinals.
The licensee here is Cannatech Medicinals Incorporated. They are seeking a change of ownership and control over 2 adult use licenses and are requesting to add 2 entities. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Okay, thank you. Hearing that recommendation, I will entertain a motion to approve. Commissioner Concepcion.
So moved.
Commissioner Camargo, will you second that motion?
Second.
Having been moved and seconded, again, any questions or comments? Hearing and seeing none, Take a call of the roll. Commissioner Camargo,
Aye.
Commissioner Concepcion. Aye. Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Liberty Compassion.
The licensee here is Liberty Compassion Incorporated, doing business as Affinity. They are seeking a change of ownership and control over one medical marijuana treatment center license and are requesting to add 3 individuals and 2 entities. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you. Commissioner Stebbins, will you move to approve this change of ownership?
So moved.
Commissioner Roy, will you second that?
Second.
Are there any questions or comments? Hearing none, I will take a call of the roll. Commissioner Camargo.
Aye.
Commissioner Roy.
Aye.
Commissioner Concepcion. Aye. Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Toro Verde, 1, 2, and 3. Although we'll take these up separately, right, Annie?
Yes. The
All right.
licensee here is Toro Verde, Massachusetts Incorporated. They are seeking a change of ownership and control over one adult use license, and they are requesting to add 1 individual and 1 entity. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you. I will entertain a motion, Commissioner Roy, to approve the recommendation for Toro Verde.
So moved.
Commissioner Concepcion, will you second that?
Second.
Having been moved and seconded, are there any questions or comments? Hearing none, I'll take a call of the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion. Aye. Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Again, Toro Verde 2.
The licensee here is Toro Verde, Massachusetts 2 Incorporated. They are seeking a change of ownership and control over one adult use license, and they are requesting to add 1 individual and 1 entity. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you. Commissioner Camargo, I will entertain a motion to approve Toro Verde 2.
So moved.
Will you second that, Commissioner Stebbins?
Second.
Having been moved and seconded, any comments or questions? Hearing none, I will call the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion. Aye. Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. And finally, Toro Verde 3.
The licensee here is Toro Verde, Massachusetts 3 Incorporated. They are seeking a change of ownership and control over one adult use license and are requesting to add 1 individual and 1 entity. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you. I'll entertain a motion, Commissioner Concepcion.
So moved.
Commissioner Camargo, will you second that?
Second.
Having been moved and seconded, I will take a call of the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion. Aye. Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. And finally, Tyka Green.
The licensee here is Tyka Green Incorporated. They are seeking a change of ownership and control over 3 adult use licenses and are requesting to add 1 individual. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend review and decision on this request, and if approved, do request your approval be subject to the conditions before you.
Thank you. Commissioner Roy, I'll entertain a motion to approve.
So moved.
Commissioner Stebbins, will you second that?
Second.
Having been moved and seconded, any questions or comments? Hearing none, I will call the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion. Aye. Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Moving on to approval of provisional licenses.
The applicant here is Bread Genetics Incorporated, doing business as Flower Express. The proposed location is 270 Greenfield Road in Coleraine. They are seeking a Tier 5 outdoor cultivation license, and this applicant received expedited review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
And Commissioner Roy has a condition.
For Bread Genetics, prior to final licensure, please inform the Commission of your additional operational plans for outdoor marijuana cultivators as it relates to quality control samples in accordance with 935 CMR 500-12012 and 935 CMR 500-12014. Thank you.
Subject to that condition, I will entertain a motion to approve the provisional license of Bread Genetics number MCN 283581. Commissioner Concepcion?
So moved.
Commissioner Rowe, will you second that motion?
Second.
Any questions or comments? Hearing none, I will take a call the roll. Commissioner Camargo?
Aye.
Commissioner Roy?
Aye.
Commissioner Concepcion?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye, 5 in favor, none opposed. Moving on to Elevated Inc.
The applicant here is Elevated Incorporated. This is a co-located establishment with a proposed location of 56 Sterling Street in Clinton. They are seeking a Tier 11 indoor cultivation and a product manufacturing license. This applicant received general review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you, and Commissioner Roy has a condition.
For Elevated Inc., a cultivation Tier 11 indoor. Prior to final licensure, please inform the Commission of your additional operational plans for indoor marijuana cultivators as it relates to quality control samples in accordance with 935 CMR 500-12012 and 935 CMR 500-12014.
So subject to that condition, Commissioner Stebbins, I will entertain a motion to approve the provisional license of Elevated number MCN 283819.
So moved.
Commissioner Camargo, will you second that?
Second.
Having been moved and seconded, I will call the roll. Commissioner Camargo?
Aye.
Commissioner Concepcion?
Aye.
Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye, 5 in favor, none opposed. Elevated Inc. Product Manufacturing.
That was actually included in the other.
Oh, okay.
Oh, I had a condition for that one. Do I read it now?
I'm just trying to think, do you want to, what is the condition? That's product manufacturing. What is your condition? And then we can move to, I'm trying to think.
Should she just read that one again? Maybe
Yeah.
this to start from
Is it
scratch.
a different condition?
Yes and no. It's the same condition, but it's applicable to product manufacturing, not Tier 11 indoor, not cultivation indoor.
So
It's a different reg,
just so you
so
know,
yeah, it's different.
I had said elevated
I know it's the
in
same.
cultivation. I thought we took a vote on, I just took a vote on MCN 283819. So even though you've read that together, you now have your conditions, so we can take a separate vote on this.
Okay.
I mean, counsel, he's nodding his head. Okay, so I will entertain, so have you've read the condition?
No, I'll read it now.
Please read the condition.
Okay.
Because I enunciated an individual vote. So we took an individual vote
Okay.
on the cultivation. So now, even though she did it together,
Okay,
I think we're okay.
sounds good.
Okay.
Okay, for Elevated Inc. Product Manufacturing. Prior to final licensure, please inform the Commission of your additional operational plans for product manufacturers as it relates to quality control samples in accordance with 935 CMR 500-135K and 935 CMR 500-139.
Okay, thank you. So subject to the condition imposed by Commissioner Roy, I will entertain a motion to approve Elevated Inc. MPN 282036.
So moved.
Commissioner Concepcion, will you second that?
Second.
Any questions or comments? Hearing none, I will call the roll. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. We got through that. Okay. Sorry about that. Green Soul Organics.
The applicant here is Green Soul Organics Incorporated. The proposed location is 759 Massachusetts Avenue in Cambridge, and they are seeking a retail license. This applicant received priority review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you. And we, two commissioners have conditions. Commissioner Roy, would you read yours first?
Sure, and I want to just congratulate Green Soul. They are an economic empowerment applicant, so I just want to congratulate them. And having said that, my condition for Green Soul Organics, Inc. is prior to final licensure in accordance with 935 CMR 500-146. Please include the phone number for the Massachusetts Substance Use Helpline on your consumer education.
Thank you. Commissioner Stebbins?
Sure. My proposed motion, condition is prior to final application for licensure, review positive impact plan and consider any strategy for outreach to nearby area of disproportionate impact designated communities of Chelsea and Revere and provide any update in accordance with 935 CMR 500.101 1A11 to the CCC licensing division.
Thank you. Commissioner Stebbins, I'll entertain a motion subject to those two conditions to approve Green Soul Organics number MRN 284855.
So moved.
Commissioner Concepcion, will you second that?
Second.
Having been moved and seconded, I'll call the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion. Aye. Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Moving on to M2B.
The applicant here is M2B Home Delivery Incorporated. The proposed location is 139 Silvio O. Conti Drive in Greenfield. They are seeking a marijuana delivery operator license, and this applicant received expedited review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you. And there are no further conditions. So Commissioner Roy.
I have a comment.
Oh, you have a comment.
Okay.
Good.
Sorry.
That's
I
okay.
just want to congratulate MTB. They are a social equity participant. And I also want to thank them and congratulate them for having their consumer education as delivery operators. So I always say they're a retailer on a store on wheels, and I was really happy to see their educational material. So I just wanted to congratulate them for that.
Thank you. So with that wonderful commentary, would you care to make a motion to approve?
So moved.
Commissioner Concepcion, will you second that?
Second.
Having been moved and seconded, any questions or comments? Hearing none, I'll call the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Nash Mac LLC.
The applicant here is Nashmac LLC, doing business as Cannabarn. The proposed location is 678 Adams Street in Abington, and they are seeking a retail license. This applicant received priority review. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you. Commissioner Roy has a condition.
Thank you, Madam Chair. And before I read my condition, I want to congratulate Nashmac LLC. They are an economic empowerment applicant, so congratulations. My condition is prior to final licensure in accordance with 935 CMR 500-146G. Please include information for substance use disorder treatment programs and the phone number for the Massachusetts Substance Use Helpline on your consumer education. Thank you.
Thank you. Commissioner Stebbins has a condition.
Sure. Thank you, Madam Chair. First condition is prior to final application for licensure, review and update diversity hiring goals in diversity plan based on statistics of host community and region, and not only based on overall state statistics in accordance with 935 CMR 500.101 1C8K, and provide any update to CCC licensing division. The second condition is prior to final application for licensure, review diversity plan and clarify and align intended goals in A3 and B3-4 in accordance with 935 CMR 500.101 1C8K, and provide any update to CCC licensing division. Just a note on that, great diversity plan, but there were some numbers that seemed kind of misaligned. So if they can just kind of go back and make that correction.
For me, I was actually just writing because I was gonna.
Yeah, and in one of their intended goals, they had 1%, and it looked like in another diversity goal that read the same way, they had a different percentage goal. So just asking them to align whatever number is right.
Okay, I think that's helpful. Thank you. All right, so subject to those conditions, Commissioner Stebbins, would you move to approve this provisional license?
So moved.
Commissioner Roy, will you second that?
Second.
Having been moved and seconded, I will, any questions or comments? Hearing none, we'll take a call of the roll. Commissioner Camargo?
Yes, Madam Chair, I'll have some comments after we vote on this license,
Oh, okay.
but I'll say aye. I will vote aye.
Okay. Commissioner Concepcion? Aye. Commissioner Roy?
Aye.
Commissioner Stebbins?
Aye.
Chair votes aye, 5 in favor, none opposed. Commissioner Camargo?
Yeah, thank you. Thank you, Madam Chair. Thank you, colleagues. It's a reminder when we're reading through these provisional licenses, and I think everybody, when you're doing renewals, specifically, when you're also applying for provisional licenses, when it comes to your positive impact plan, there's a lot of licensees out there that will go figure out what kind of partnerships they're going to have, what nonprofit organization they are going to partner with. For some instances, we see a letter of partnership or sort of a MOU or some kind of agreement when licensees say, oh, I'm going to partner with X nonprofit and we're going to give them $5,000 for the year. It's nice to see those partnership letters. However, I need to say, and I've said this before, there's licensees that will start those partnerships, create those partnerships, add the letter of partnership within the provisional licenses, and then not carry on their duties as licensees to nonprofit organizations. We are not managing nonprofit organizations. Obviously, we're not regulating nonprofit organizations. But what I want to say to licensees and specifically folks that are in the provisional stage and also the renewal stage is if you make a commitment to a nonprofit organization and you can't keep it, have that communication with them. Because in some instances, licensees are not keeping their commitments with nonprofit organizations, but are still using those letters in renewals. But also, this is where I see it starting within the provisional licensing. So I've seen a couple within these provisional licenses that had their partnerships, but it is a problem in the industry. I don't think we talk about it as much in public. I would say to nonprofit organizations and to licensees, check in with the Attorney General's office, right? There's a nonprofit department that can help folks in terms of resources, but be very mindful. And I always tell people, if you can't keep your commitment, just have a conversation with your nonprofit organization. And if you did not, hold your end of the bargain, turn in a letter and say, hey, we didn't do this part of the bargain, because our equity mandate is real, it's serious, and it's part of giving back to these communities that have been disproportionately impacted by the war on drugs, the people that these nonprofits serve. So I just want to put that out there because I've seen a few things and there are a few complaints running around about nonprofit organizations either being taken advantage of or not being clearly notified with licensees that are partnering with folks. So I'm putting that out there and just saying it. I'm sure we'll have more conversation about it. But Madam Chair, thank you for allowing me to speak on that.
And Commissioner Camargo, and I thank you for making those comments because I couldn't agree, more. I actually was stopped at an event a couple of weeks ago by someone who ran a nonprofit who had given a letter of support. This group promised X amount of money, they budgeted that, and then they did not give them the money. This, I think, leads me to what I hope we'll have a broader discussion about 5 years in. What does equity mean? We've gotten criticism from some folks in the legislature that approximately 50 persons who are in our EE or SEP program that are licensed. We understand that that's still part of our mission and part of the commitment that we have to hold true. But it's also these positive impact plans. And I'm still sort of learning and understanding, as I've shared with Commissioner Stebbins, I don't like creativity. I want to make sure, I personally would like to make sure that we give very clear direction as to what we think impact can and should be. So one of the things I hope that we can do, in the coming months is really understand and measure what is that impact. Is it the impact that we want? And can we be doing more to expand and enhance what that impact is so that we meet our mission? So I really thank you for bringing up those comments. I think we've all, gotten letters from some nonprofits saying that we think we feel a little used here. And we need to make sure that we're holding licensees accountable. If they make a promise, keep the promise. If they can't keep the promise, make sure that they're reporting back to us in a timely fashion so we can get them to rework their positive impact plan. So thank you very much for raising that. I appreciate that. And finally, provisional to Earthwell Farms. Annie, take it away.
The applicant here is Earthwell Farms LLC, doing business as Earthwell Farms. This is a vertically integrated medical marijuana treatment center with a proposed location of 526 Boston Post Road in Wayland, which will perform cultivating, product manufacturing, and dispensing operations. Additional information is contained within the executive summary for the Commission's review and consideration. Therefore, Commission staff do recommend the issuance of a provisional license subject to the conditions before you.
Thank you. Commissioner Concepcion, I don't think there are any additional conditions. I will enter. You have it. Oh,
I'm just going to add one on the fly. Is that okay?
You can do it on the fly. You're good.
Okay, thank you very much. So their goal number 2 in their positive diversity plan, which I applaud, implement a mentorship program. But as I've done in the past, and we encourage mentorship programs, I think they're wonderful. And this is no means a reflection on this condition, but for everybody's safety, I'm going to add this condition: prior to performing job functions at a marijuana establishment, all mentor program participants, as stated in goal number 2 of your diversity plan, must become registered agents in the Commonwealth of Massachusetts and provide agent registration card to the Commission upon request pursuant to 935 CMR 501-030. A marijuana establishment, well, this is an MTC, so a medical treatment center, shall apply for registration for all its employees, owners, executives, and volunteers who are associated with that MTC.
Could you provide a little clarity for that? Because I think that your point, maybe well taken, but maybe also sharing with other licensees.
Sure. I mean, I've applied this condition a few times in the past, and let me just reiterate, I think mentorship programs are phenomenal. They're awesome. It's a great way to learn, and I hope we incorporate them here at the Commission. But I don't want folks to lose sight that maybe they are, let's say, a college student, right? And they're in a few hours a week. If they're plant touching, they're in there. They do need to be a registered. We do need background checks. They do need to be a registered agent, and that's for everybody's safety. So it's just a friendly reminder that if they do execute this mentorship program, that those folks do need to become registered agents. Okay.
Thank you. All right. Hearing that, I will Commissioner Roy, I'll entertain a motion to approve the provisional license of Earthwell Farms LLC, number RMDA 3874.
So moved.
Commissioner Camargo, will you second that?
Second.
Any comments or questions? Hearing and seeing none, I will call the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. Earthwell Farms, 5 in favor, none opposed. Now we are moving to staff recommendations on denial of provisional licenses. And will we be talking to legal staff at this point? Who is going to be leading this discussion for us? Do we have anyone here? Or do you want to?
I think I want to make a
Okay,
motion
all right.
before we
Why don't you make,
that
okay,
one.
all right. Why don't you do that?
And I'm leaning forward in case I'll put my microphone on. Because this is unique, and it's a suitability matter that Executive Director Collins made. He made the findings that we're now being asked to affirm. I want to put a motion on the table before we even get into a conversation this month. So I'd like to make a motion to table this for a future meeting when the Executive Director is available.
Okay. Would you care to second that one?
I'll second it.
Okay. Are there any comments or questions?
No.
Okay. The only comment I will make is, again, just sort of understanding the process here. This was a recommendation of the staff. It has been signed off by the Executive Director, whose prerogative it is to kind of, be the sort of final arbiter before this comes to the commission. There are some questions that we will have, and we would like to make sure that he's back so that we understand the sort of weight and impact of his decision. But also, this is a case of first impression for us.
Yes.
And so we need to clarify that. So again, just wanted to make that statement. I want to thank our staff for all the help that they have put into making this happen. So having been moved and seconded, any questions and comments?
I just want to thank Commissioner Concepcion for that motion. I think it's important that we have all the resources available to us when we have questions. We don't take this lightly, a denial. This is a very serious issue. So I want to thank you for that.
Okay, I will take a call of the roll. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Aye.
Commissioner Roy,
Aye.
Commissioner Stebbins,
Aye.
Chair votes aye, 5 in favor, none opposed to table. And we will be having a second meeting in the month of June. And so we will determine whether or not that will be on the agenda, pending a determination as to whether or not the executive director will be in attendance at that meeting, as long as everyone's comfortable with that. Okay, now moving on to staff recommendations on final licenses.
There are 12 final licenses for review and consideration before the commission today. Other than that, I don't typically
That's
do a
okay.
presentation for you.
That's okay. Just want to give you one more chance for your time in the spotlight, and you're doing fabulous. So thank you
Thanks.
very much. Thank you. All right, so anyway, staff recommendation on final licenses 1 through 12. There are no conditions, any abstentions or recusals. Hearing and seeing none, I will entertain a motion, Commissioner Concepcion, to approve the final licenses 1 through 12. And will you make that motion?
So
Commissioner Roy, will you second that motion?
Second.
Any questions or comments? Hearing and seeing none, I will call the roll. Commissioner Camargo.
I just want to say congratulations to all those folks. I always think it's such a big deal. So aye.
Very good. Commissioner Concepcion.
aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. Staff recommendation on final licenses numbered 1 through 12 on our agenda are approved. Now, staff recommendations on renewal licenses. Commissioner Stebbins, you have a comment?
Yeah, thank you, Chair. Just real quick, as always, like to thank our licensing team, Annie, Sarah, Amanda, and Director Potvin for the time that they take to go through all the renewals, see what questions we have. I think going back to Commissioner Camargo's earlier point, watching to see how licensees pivot with their plans, both around diversity and positive impact. But just a reminder to all of our licensees when they come up for renewal, you get notices from our licensing department. One of the critical pieces of that is a licensee reaching out to their host community, asking about any costs that have been realized or impacted on the town by virtue of their operation. When you get that notice, there is some specific language you can pull from that renewal notice and immediately kind of cut and paste it into an email or a letter to your host community that will hopefully erase any confusion or any misunderstanding with respect to what a licensee is looking for from their host community. So encourage you to take that language that's in the renewal notice and plug it right into any communications that you have with your host community.
Thank you. And I see that you have a condition on number 49. So, Commissioner Stebbins, I will accept a motion to approve renewal licenses numbers 1 through 48. Will you make that motion?
So move.
Commissioner Roy, will you second that motion?
Second.
Any questions or comments? Hearing none, I will call the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion. Aye. Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye. Let the record reflect 1 through 48 are approved. 5 in favor, none opposed. Now we get to number 49, Salty Farmers. Commissioner Stebbins as a condition.
Sure. Thank you, Madam Chair. The proposed condition is within 30 business days of approval of application for renewal, contact CCC Licensing Division for an update to identify any goals for residents with disabilities under the licensee's diversity plan in accordance with 935 CMR 500.1034B. Just a note, again, great renewal. They did pull out and extract information in their diversity breakdown of employees that they have hired with disabilities. So they're tracking all that information. However, there is not a goal separately alluded to in their diversity plan. So we're just asking them to go ahead and plug in a goal. They're tracking all that data already. Be helpful in their diversity plan to have a goal.
And in following up on that, I actually think it's important that we figure out how to engage the disability community. As a matter of fact, and I'm blanking, former state rep is actually now running the disability legal group, and we might want to engage them in understanding what opportunities are made available to folks with limitations that they can become involved in the cannabis market. So I will entertain a motion subject to Commissioner Stebbins' condition to approve the final license or the renewal of license of Salty Farmers. Would you like to make that motion?
So moved.
Commissioner Concepcion, will you second that?
Second.
Any questions or comments? Hearing none, I'll take a call of the roll for number 49, Salty Farmers. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Now taking 50 through 75. Commissioner Roy, I'll entertain a motion to approve these final 50 through 75.
So moved.
Commissioner Concepcion, will you second that?
Second.
Having been moved and seconded, any questions or comments? Hearing none, approve numbers 50 through 75. Take a call of the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Now moving on to staff recommendations.
I just have a comment
Oh,
about
please.
the
Okay,
executive summary. So before we move on, I just want to talk about the marijuana establishment renewals, the executive summary. We get it every meeting book, and every month I look for the municipal costs to be disclosed. And every month I see 0.00 all the way down the line. So I just want to recognize the city of Cambridge, Southbridge, and the town of Hanson for at least providing some information around municipal costs. And I look forward to Commissioner Concepcion and myself as the regulatory lead on the HCA working group as we work to draft regulations and have public comment around HCA's, with the Chapter 180, the Acts of 2022. I look forward to a more robust conversation about the 0.00s and about.
We're gonna get robust.
Yes. So I just wanted to, recognize Cambridge and Southbridge and Hanson. Thank you.
Commissioner Roy, I'm glad you made that comment.
Thank you. All right. So again, now moving to a staff recommendation on responsible vendor training, dispensary teams, number RVN 454027.
The applicant here is Dispensary Teams. They are seeking a 2-year certification to provide basic core curriculum training in the Responsible Vendor Training Program, and they plan on providing virtual training environments. Commission staff recommend commission approval subject to the conditions before you.
Thank you. I don't know if there are any comments or questions, but I will, Commissioner Stebbins, I will entertain a motion to approve the staff recommendation on responsible vendor training for dispensary teams.
So moved.
Commissioner Camargo, will you second that motion?
Second.
Having been moved and seconded, hearing any questions or comments, I hear none. Take a call of the roll. Commissioner Camargo.
Aye.
Commissioner Concepcion.
Aye.
Commissioner Roy.
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed.
Madam Chair, I just, along RB,
Okay, we don't have our executive director's report.
So I-
It's gonna be a quick
Quick,
meeting
quick,
today,
quick.
relatively.
um,
We don't know.
I just want to, around the RVT, just remind folks that we did announce, our comms team did announce recently that there's advanced curricula in social equity program curricula. So we look forward to, RVT shouldn't be a stagnant, stationary thing. It should evolve, right, as the industry evolves. So I look forward to working on this more and taking a deep dive into the RVT at some point.
Thank you. Completely agree. All right. Now, we are moving on to commission discussion and votes. And again, just for the general public, because the executive director is not here today, we do not have the executive director report, which generally tends to take some time, and it's a monthly update. Again, we apologize, but we will have an update in the not too distant future. So again, happy that we can make this meeting short. Sorry that we don't have our executive director here to share some updates.
Can we take a 5-minute break?
We can take a 5-minute break.
Thank you.
Yes, okay.
Thank you.
Would you like to make a motion?
I definitely would.
You
So
want it
moved.
to be 5?
Thank you.
How
5
about
is good.
7? Okay,
7's perfect.
All right,
Thank
we
you.
will be back at 11:10. So this has been moved. Well, is this seconded? Second. Moved and seconded.
Thank you.
Commissioner Camargo,
Aye.
Commissioner Concepcion.
Aye.
Mr. Roy.
Aye.
Mr. Stebbins.
Aye.
Chair votes aye. We will be back at 11:10.
Thank you so much.
Thanks, Kate.
Thank you. Okay, so we're now going to commission discussion and votes, and Commissioner Camargo couldn't hear us. But we're going to switch the agenda, and we're going to start with topics for legislative and executive branch outreach. And did Commissioner Concepcion want to start?
I'll just do a quick refresher about our executive and legislative outreach strategy. It was created to create a process to discuss legislative matters and vote on whether or not to take any action, and also give each commissioner an opportunity to voice their support on the record, as well as provide clarity to the legislature and the public on the commission's official position as one body. So with that said, I know this is Commissioner Roy and Commissioner Stebbins' agenda item, and I will pass it over to you guys.
Thank
That's
you
okay
for
with
that.
Madam Chairwoman.
Thank you so much, Commissioner Concepcion, and I will, who's going to go first?
Do you want to jump into the slides, or do you have anything you want to kick off the conversation?
No, we could just jump right into the slides.
Okay, all right. So, good morning, everyone. Very important topic that Commissioner Roy, I want to thank her for her leadership in teeing up this issue. Just have a few slides to run through this morning, and this is really obviously specific to access to medical marijuana here in Massachusetts by our veterans across Massachusetts. This first slide is to really just give you a background, one on the veteran population here in Massachusetts. As you can see, it's about 309,447 veterans, obviously spread across many years of service in our armed forces. Roughly 71,000 Mass veterans are enrolled in the VA healthcare system. And just under 11,000 have a 100% service-connected disability rating and designating them as permanently and totally disabled. The Veterans Health Administration, obviously under the Federal Department of Veterans Affairs, is the largest integrated healthcare system in the United States, providing care at over 1,200 healthcare facilities across the United States, including 171 medical centers and over 1,000 outpatient sites of care, serving 9 million enrolled veterans every year.
Okay.
Next slide.
So I just want to talk about some of the challenges that veterans face in regards to healthcare in their health. Veterans are more susceptible to opioid addiction, as they are more likely to suffer from chronic pain. In addition, many veterans suffer from mental health problems like post-traumatic stress disorder, making them more likely to abuse drugs and alcohol and attempt to self-medicate. According to the NIH, U.S. military veterans have been heavily impacted by the opioid overdose crisis, with drug overdose mortality rates increasing by 53% from 2010 to 2019. The risks for overdose that veterans face need to be understood as resulting from an ongoing interaction among biological, physiological, psychological, and social structure factors. And what I really want to stress here today is addressing drug overdose in the veteran population requires accessible and non-judgmental, low threshold, wraparound, and holistic solutions that recognize the complex etiology of overdose risk for veterans. Next slide, please.
So our topic or focus today is on our legislative outreach, and is as much as I always advocate for this commission having as much time to think through issues and put things on agendas, we try to work around the open meeting law. Sometimes the legislative activity on Beacon Hill can outpace our activity. So this is coming up before you for discussion and consideration around expanding the definition of qualifying patient and debilitating medical condition. These are obviously all provided in the medical cannabis statute. Our suggestions today are around, again, expanding the definition of qualifying patient, and this is how it could read in a new statute by adding under qualifying patient a veteran receiving their health care at a federal Veterans Administration facility and provides their Veteran Administration blue button report problem list indicating an existing debilitating medical condition to the commission. And I know Commissioner Roy will speak in a moment about what a blue button report is. Secondly, under the definition of debilitating medical condition, we're interested in supporting that legislative language, which would include or add to debilitating medical condition, post-traumatic stress disorder, opioid use disorder, and other conditions as determined in writing by a registered qualifying patient's registered healthcare professional. And again, PTSD, as we know, affects our veterans, but it also can be extended to also impact many of those who are in emergency response services. So those are kind of the two sections of the statute where we are looking to support legislative activity that will expand those definitions. And I'll hand it over to Commissioner Roy to talk about a blue button report and other jurisdiction activity.
And if I can just share a fun fact, being in Worcester, Blue Button was actually developed. The development was led by Dr. Peter Levin, who was a WPI professor and happens to be a friend of mine. So this is a huge project. And frankly, I don't think that we use Blue Button enough.
Thank you.
So
I didn't know that.
Yeah.
Great profit. The Blue Button report was created in August of 2010 by President Obama, and he announced the creation of a new Blue Button. So a Blue Button report is a web-based feature through which patients may easily download their medical histories and share it with healthcare providers, caregivers, and others they trust. Other jurisdictions that have increased access to medical marijuana for veterans include Illinois and North Dakota as well.
Can I ask a quick question? Because in sort of understanding a little bit about Blue Button, which is frank, I think it's the largest central repository of electronic health records like in the world. One of the issues that was raised was about whether or not we keep and this is a conversation for later because obviously this is legislation that's going through, but making sure that we understand maintaining private healthcare data and making sure that, you know, we reduce the opportunity. So I just want to make sure at some point.
And the commission is familiar with that. We do background checks, right, with highly sensitive information. So the commission is very well adept at properly storing sensitive information. And we have a history of that. So,
but my sense is that with this Blue Button, there may be a way to get information flagged without necessarily having to hold it here.
okay.
But are we talking to the VA right now?
Are we talking to the VA? It's federally illegal, so I have not had a conversation.
We can't talk to the VA.
Yeah, so the 11, what was the number, Commissioner Stebbins, that get their health at the VA, I think it was 11,000. So they have a problem list that falls under that Blue Button portal, which many times is just a simple one page.
Right.
And it would list the qualifying conditions. So that one page, they're getting their care. They have a bona fide doctor-patient relationship, right? They already have that. They've already been identified as having these qualifying conditions. So today's conversation is removing that extra hurdle, that financial burden and barrier. I'm hearing anecdotally that some veterans are being made to re-register multiple times a year.
Yeah.
I mean, we're talking $200 to $400 at a time. So, so this Blue Button report would identify those, according to statute or regs, those qualifying conditions and satisfy, and they already have a bona fide doctor-patient relationship.
Okay. Thanks for clarifying that. I appreciate that.
Before we move to the next slide with motion language, I want to take an opportunity here to read a letter. And it's from, he's here with us today, Stephen Mandilli. He's a disabled sergeant in the U.S. Army and Massachusetts Army National Guard. He served in Operation Iraqi Freedom in 2004 to 2005. He's a member of the Uxbridge Select Board and the Blackstone Valley Opioid Task Force, members of Iraq and Afghanistan Veterans of America All-Star Advocacy Team. So Stephen is here with us today. Stephen sent a letter to Commissioner Stebbins and myself. And Stephen, it's okay for me to read this on your behalf?
Yes.
Okay. This letter is from Stephen Mandilli. My name is Stephen Mandilli, and I am one of thousands of Massachusetts veterans and countless veterans across America that have found more healing and improvement in my quality of life with cannabis than I did with what my VA physician was and still has to prescribe for me for my injuries and ailments because of federal prohibition on cannabis. From 2005, when I was injured in Iraq, to 2015, I took whatever medications my VA care team prescribed to me. Over those 10 years, I was prescribed over 50 medications, including oxycodone, OxyContin, morphine, Valium, Xanax, Ambien, and fentanyl, all of which did great at numbing the pain at first. But over time, I became numb to most every feeling except the desire for more. During that decade, I was an angry shell of the man I once was. I would rarely leave my home. Everything irritated me, and I had an uncontrollable anger where I would most often choose violence over any rational decision anytime I felt a threat, which was most of the time. The feeling of being a burden to my wife and useless as a father to 2 infant daughters became too heavy for me, which led to an attempt at ending my life. I would spend hours each day thinking of ways to kill myself without my body being found, as to not shame my family so they could say I just disappeared. I was constantly on Google Maps looking for national forests and protected lands with dense woodlands so nobody would be able to locate my body. Instead, one night I took a handful of oxycodone, Xanax, and fentanyl patches to end my life, but I choked on it and it failed at taking my life. A failure that I am grateful for every day now. This led to my wife demanding I get off of those drugs, and what she suggested I replace them with shocked me. Medical cannabis. At the time, medical cannabis had recently been legalized and dispensaries were anticipated to be opening shortly. My initial thought was, do you really think I should be sitting around smoking weed? Her thought was that anything was worth a shot, and I knew that cannabis was safer than what I was on. After looking up what exactly I was taking for the previous 6 years, I learned that fentanyl was equivalent of pharmaceutical grade heroin, so I gave it a go. Making that life-improving switch came with many barriers, with the largest being financial. My wife and I had to discuss how we would go from spending $0 for my VA prescribed medicine to spending just over $1,000 a month for medical cannabis, which leaves me still with a feeling of being a burden on my family. This led me to do research on how to make it less expensive for Massachusetts veterans. So I developed a discount program that gives veterans with 100% SC disability rating a 40% discount off of their medical cannabis purchases. I've gotten nearly 20 Massachusetts medical cannabis retailers to adopt this program so far. This helped a number of veterans here in Massachusetts, but not enough. According to current reports by the Department of Veteran Affairs, the veteran population of Massachusetts is 309,447. Of those, roughly 71,000 Massachusetts veterans are enrolled in the VA healthcare system, with just under 11,000 having 100% disability rating designated them as permanently and totally disabled. I knew that the best way to help the most veterans was with creating policy for all Massachusetts veterans. So I started learning what that takes. I knew that policy changes like this would require more than my personal story. That, like every other problem, I would need more data. Since overcoming a decade-long addiction to opioids, benzodiazepines, and sleeping pills, with the use of cannabis, I have found healing and purpose. Although the guilt of giving up hasn't gone away, I am now able to feel like a dad that gets to be the father of the 2 greatest girls ever created and a husband to the most incredible woman to ever exist. Cannabis alone did not make that happen. It took a support system along with other therapy methods, learning what being present was and how to do it in time. I'd love to say that I am 8 years into recovery, but because of continued federal scheduling of a class 1 drug along with heroin and the prohibition of cannabis at the VA. As recent as last May, while being treated for my service-connected injuries, I was given opioids. It was not allowed to be discharged until signing to leave with a bottle of oxycodone and a box of Narcan. Clearly, the VA needs to reform their policy on cannabis, as well as medications like benzodiazepines and opioids. They are being used by and are needed by veterans, but the one being used for harm reduction and that does not have the side effect of overdose death is prohibited. Veterans deserve a choice. I understand that medical cannabis is not for everyone, but for thousands of my sisters and brothers in arms in Massachusetts and myself, it is a form of harm reduction that allows us to keep working on healing and doing so feeling an improved quality of life. So this is why I will always do whatever work needs to be done to remove as many barriers to access of medical cannabis for my fellow veterans until we get a VA policy that ends prohibition and creates access. Best, Stephen Mandilli. Thank you. Thank you, Stephen.
Now what? You didn't cry.
I didn't cry, but I cried when I first read it in my house.
We thank you. I mean, that is an incredibly moving story. And I think that one that needs to be told broadly, and we really thank you for all the work that you do, Steve. It's really important.
Yeah,
So
thank you for sharing. This is your personal story, and in order to effectuate change, you have to share that, and I'm grateful to you for your service and for sharing that.
And you're just one story, and you're helping people who have a similar tale to tell. So thank you.
Can I
Madam Chair.
also,
Please, go ahead.
Yeah, go ahead.
I just wanted to sort of reiterate, thank you for being so honest and transparent about your personal story. I did get a little bit choked up. That is how things get changed. So I just want to really thank you. I know we spoke a little bit before during the break, and that little snippet that you told me during the break was powerful. That letter, I just want to thank you for putting yourself out there and doing the work and continuing to push forward. My brother-in-law also served in Iraq. So I tip my hat off to you because I know that it takes a lot and you've done a lot for us in this country. So I just want to say thank you. And to Commissioner Stebbins and Commissioner Roy, I also want to commend you both for taking the initiative and bringing this conversation to the commission floor. So thank you.
And may I just add, there's an advocacy day, at the State House on June 22nd, and Commissioner Stebbins and myself plan on attending. And I think it would be a powerful message if the commission had one voice and we spoke around this and we were able to share that on the advocacy day as well.
Yes.
Thank you. Commissioner Stebbins?
Sure. Thank you, Chair, and thanks, Stephen, one, for being brave enough to share your story. And I know that story is shared on behalf of a lot of your veteran colleagues. I've heard the message before from folks that I've talked to who serve veterans across the Commonwealth. And I want to thank my colleague, Commissioner Roy, for her leadership in tracking this issue and bringing it up. I believe the federal prohibition of cannabis has had a chilling effect on our veterans' ability to seek treatment here in Massachusetts, and perhaps even to pursue employment in the cannabis industry. We talked about the challenges our licensees have run into trying to recruit and hire veterans for their business operations. While there are bipartisan bills in DC that have been filed to expand research into cannabis and the effect it can have for veterans seeking relief from PTSD and other service-related health concerns, those efforts to date have not been successful. Additionally, efforts in bills in DC to make permanent Veterans Health Administration guidelines that allow veterans to seek care from certifying physicians in states where medical cannabis is legal has also not approved. So this is really a question of access and equity for our veterans. Today, the CCC allows for a military ID to be used to verify an individual in our patient's application, but we do not ask whether someone is a veteran or not. We also don't have a clear picture as to the impact our medical program may be offering to veterans across the Commonwealth. According to Dr. Johnson and our research department, veterans are one of the most under-researched populations when it comes to cannabis use. So today's item is to direct our legislative outreach in a timely fashion and with one voice. Could be helpful to the debate and discussion of any proposed legislation. Again, our interest is to express our support for an overall message, and that message is to continue to open doors for veterans to access care through our medical treatment centers and not a voice of overall support for a specific bill. So I'd also encourage our government affairs policy team to help us reach out and connect, one, with the great new leadership at the Mass Department of Veterans Services. I know there was an announcement that the deputy secretary is a woman veteran, so we would welcome the opportunity to meet with the new leadership within the state, but also invite our government affairs and policy team to help us connect with the Massachusetts federal delegation.
No, who's the?
It is Secretary Santiago, I believe.
Oh, yes, that's right. Yes.
Who was
Former
the
state,
state rep. And also invite our team to help us reach out to.
But by the way, not only being a veteran, he's an MD, so he has
Yes.
particular, convergence of experience.
Exactly, exactly. And I hope we can also reach out to our federal delegation to see how information that we want to make an effort to collect in Massachusetts might be helpful in their ongoing legislative efforts in Washington. So again, the commission policy, as you see on the slide, is what we're seeking support for today. And again, allows the Cannabis Control Commission to speak with one voice on a topic, not specifically to a specific bill, but certainly demonstrates our interest in seeing the expanded definition of qualifying patient as well as expanding the definition of debilitating medical condition.
Thank you. Commissioner Camargo, I don't know if you have any comments you'd like to make?
Yes, thank you, thank you, thank you. Stephen, I can't see you, but I think you're in the audience.
Yeah.
So I just want to say thank you. You and I met back in September of 2021 with Commissioner Roy, and you gave us a presentation. We talked. I remember that day. So I'm glad to see that, we continue to do the work, and, thank you for all your advocacy. A lot of this work, folks like Commissioner Concepcion said in the beginning in our opening remarks, this job is so interesting, and we can make it what we want to make it. So, you on the other end doing your advocacy and helping us to sort of shape policy. There's an outside inside game, right? So you're on the outside, we're on the inside, and we're doing this together. I remember you telling me back in September of 2021 that you had started working with Chairman Hoffman to eliminate the $50 fee from the registration cards and whatnot. And I recall your story. You shared a little bit with us. So I thank you for it. Commissioner Roy, thank you for taking this on. And Commissioner Stebbins, I know we had a brief conversation, Commissioner Roy, but so that we didn't break open meeting law, we went this route. So thank you so much. I also want to just say, Commissioner Stebbins, thank you in advance for your comments earlier about sort of the timing, right? In terms of adding sort of the slides yesterday and us having, a quick turnaround. And I think it's one of these things where sometimes we have to move quickly. So just acknowledging that, we just got these slides yesterday. I appreciate that, because sometimes, we want to prepare, we want to make sure that we have everything for the conversation, but this is a very important issue and it's very timely. So I appreciate it. I'm glad that you were, transparent about that. And, I just want to say thank you. This is key. And, I think, Chair O'Brien, we're having a conversation after this, just sort of about things that we can sort of change and move forward that have been sort of like delayed throughout the commission because of where we're at. So thank you so much. And thank you, commissioners, for leading on this discussion. And thank you, Stephen. I'm glad that you're in the audience today. Sorry I couldn't be there.
And
Commissioner Roy?
Yeah, and I just want to acknowledge Dr. Marion
Oh,
McNabb,
please.
who has been a true champion for veterans. For those that don't know Marion, she's a great ball of energy, and I've had the honor to work with her on the research subcommittee. And at one of our meetings, she's been doing a study in Massachusetts with local veterans and with Gibby's Garden, who's a micro business in Uxbridge. And she's now, Dr. McNabb has submitted the findings and is working with Dr. Johnson here at the commission, and it will be published. And it's self-reported medical cannabis use as an alternative to prescription and over-the-counter medication among use among U.S. military veterans. So that will be coming out shortly. We did get at the research subcommittee, which demonstrated through iCount the efficacy of medical cannabis harm reduction, cessation in alcohol use and smoking and opioid use. And the results were extraordinarily compelling. I think, Stephen, you were at that meeting when she presented those findings and that data. So I just want to take this moment to thank people that are behind the scenes that are doing, huge amount of work to advance this. So Dr. McNabb, I just want to say thank you.
One of the things I do think, and this has been on sort of my, my to-do list that's not at the top of the list, but something, but engaging the Mass Medical Society, talking about how doctors can have, we understand, when people get referred, right? And it's not necessarily your primary care physician. And frankly, right now, you can go to Groupon and get referred to do those things. I actually think that speaking to the Mass Medical Society, because I do think that we are still, I'm going to have my physical sometime in August. And I was already filling out some paperwork and asking you about, it's basically, are you using any illicit drugs? I think that was even the word that was still in there. And so I think that it may be important for us to maybe reach out to the Mass Medical Society, because obviously there have been changes on the federal level, but also making sure that their paperwork allows people to, I used to take Ambien, and I don't do that anymore. And I take gummies at night. I'm a, postmenopausal woman, and it's something that has been helpful to me. I know we're sharing today. But I do think that this is something that when you're someone who wants to share your full medical story and be transparent with the person, who, keeps you healthy, I don't think that here in Massachusetts, whether it's the VA or others, that we are working closely enough with our medical community to make sure that they understand that A, it's legal, B, there have been changes on the federal level, and C, how do we make that more accessible for, persons in the state to get the treatment that they need. So again, thanking you. I don't know how many more times we're going to thank you today, Stephen, but we really appreciate it. But I do think that this is something that we can tackle, not only for veterans, but also just healthcare in general, that we can be doing a better job. So
I had a question. I know, so our policy, we don't support individual pieces of legislation or bills, but are you aware of any, you don't have to name them, but I'll ask that you.
I am aware.
So there are.
So yes, there is a bill. There was two. One got put out, I think is going to get put out to study. So it's one that's been for years now coming around. And I think having this piece would help bolster it. I worked with Matt Giacola, so we weren't identical. So there was space. So we weren't exactly mimicking, but it's on the same trajectory. It's just not to keep in line with our policy. So Matt, thank you, Matt. He reworded it.
Okay. I'm thinking about the timeliness of it.
Yeah.
You mentioned time, and I'm thinking if there's something, okay, got it, thank you.
So
Commissioner, can I ask a quick question?
sure.
Commissioner Roy, the bill that's alive right now, who's the sponsoring legislator for that?
I co-sponsored. Do you know, Stephen, all the sponsors?
It was filed by Representative Soder and Senator Ryan Fatman.
And there's other people have signed on,
Yeah.
correct?
So just repeat that, 'cause I don't know,
There's a bunch of co-sponsors. I don't have them in front of me.
Okay,
but I don't know
okay,
if you
just
need to repeat that. Can Commissioner Camargo, could you hear Kim say that?
I did, I heard him. Yeah, thank you.
Okay.
But I
Thank you.
think it's important to clarify to anyone watching that this is not the commission taking a stance to support that bill. So I just
Right.
want to clarify,
That's right.
state it again. There are probably other things that might be coming down the pipeline that align with this statement as well.
That's right.
Might move forward, so.
And as we've learned, sometimes these things take multiple sessions, and putting a, kind of a stake into the ground as to what our position is might be reflected in other bills that might come down the line, so.
So just to clarify what Commissioner Camargo, did you have something else you wanted to say? I didn't know if you were leaving.
No, that's it. No, I appreciate it. And Commissioner Concepcion, thank you for the clarification. And also,
Definitely.
also Commissioner Roy, you talked about the advocacy, at the State House. This process, this legislative process for us allows us to advocate for the topic, right? So I just, again, I think it's a great idea, but also knowing and being clear so that folks don't, assume that we're advocating for one specific bill. So I appreciate
right.
that.
Thank you.
I have another question.
Please, Commissioner Concepcion.
So I assume that you guys have sort of thought about next steps.
Yes.
After this meeting. Do you share sort of what that outreach, if there is any outreach, sort of what the next things are?
Well, it's very high level at this point, but what, the advocacy day is the next thing. Now, we've discussed this publicly, so we're not constricted to open meeting law around it. So it's right now it's Commissioner Stebbins and myself, but everyone, we're all welcome because now we've discussed this publicly, so we wouldn't be violating open meeting law. I think historically, whether it was the Social Equity Fund and Matt types a letter that we all approve, and that gets sent to the Joint Committee on Cannabis Policy and whatever other stakeholders we feel that it would be pertinent. Maybe we send it to the Secretary of Veterans Affairs, whoever we feel are pertinent stakeholders. Hopefully Matt, we can all work with him to get that letter out sooner rather than later. And, just talk to stakeholders and however we can be of assistance to, I'd be more than willing to testify if needed down the road. But having said, this is not endorsement of any bill. This is a concept like we've done previously. And so whatever, I'm open to any other suggestions around, advocacy around this.
I think I asked that because I know we're in open meeting, so I want to make sure I convey anything that I can to both of you over here. I know that we focus a lot on the Cannabis Committee at the State House, but I would also recommend that I brought up, so I didn't butcher the name of the committee itself, the Joint Committee on Veterans and Federal Affairs.
Okay.
Because this overlaps. This is not just a cannabis issue, and there's a lot of people who are interested in this. So I would just think about.
That's right.
Where
sort
is
of
helpful?
the chairs and vice chairs.
Do we know where this bill is being referred?
I don't want to get into the bill itself.
Yeah.
Oh, okay.
Yeah.
Okay.
Because it might, you might, I don't know.
And language changes in the process, in the legislative process too. So we'll
But
stay
that's
focused on
also-
just
but
this
that's also to clarify, that's why
Yeah.
we don't vote on a bill.
Exactly.
because
Language
bills
can change, amendments can-
circumstances
yep.
change, and so we could say, oh, we're in favor of this, and then
That's right.
Exactly. So we're not saying that.
A bill can have the components that we're supportive of, but then not align with the commission's approved policy decision either, so.
That's right.
So will you be,
I think Commissioner Stebbins is going to read the motion language. That's okay.
Sure. Madam Chair, I move that the commission approve the following statement of commission policy, that the Cannabis Control Commission supports expanding the definition of qualifying patient to include a veteran receiving their health care at a federal Veterans Administration facility who provides documentations that the Veterans Administration has diagnosed the veteran with an existing debilitating medical condition to the commission. In addition, the commission also supports the definition of debilitating medical condition to be modified and expanded to include post-traumatic stress disorder and opioid use disorder.
okay, having been moved, do I hear a second?
Second. Proudly second.
There you go. Any questions or comments? Hearing none, I will take a call of the roll to endorse this statement of commission policy. Commissioner Camargo,
Aye.
Commissioner Concepcion,
Gladly, aye.
Commissioner Roy,
Aye.
Commissioner Stebbins.
Aye.
Chair votes aye, 5 in favor, none opposed. Thank you. And again, Stephen, thank you for your advocacy. And frankly, the advocacy of many people, not only, protecting veterans, but protecting healthcare in general in Massachusetts. We think this is a very important issue. So thank you very much. All right. Now, we're going to regulatory, go back a slide, regulatory review discussion and next round of topics. So one of the things I'd ask Commissioner Stebbins and Commissioner Camargo, just because we're in an open meeting and, you know, we have discrete working groups, you know, post the passage of Chapter 180. You know, I'm working on a group with Commissioner Concepcion. We will be publishing, you know, that fairly soon for social equity at the municipal level. Commissioner Concepcion and Commissioner Roy are working on host community agreements. It's my understanding that this should be, this will be finalized by staff. They're doing a review of the impact right now. That will be, people will be able to see soon, because we're getting a lot of calls from the general public, in particular about the host community agreement. I got a message yesterday from a licensee who said that their community will not negotiate the host community agreement because they're, you know, waiting to get some clarity there. But just to sort of, maybe Mike, I just want to make sure I'm repeating. I saw yesterday a sort of timeline. So within the next week or so, this language will be made public. We will be voting on this. We will be submitting this to the Secretary of State's office. We will be accepting public commentary. So, you know, we're pretty much on track to meet the November deadline to get this done and properly reviewed. Our subgroup has put out, has finalized some suggestions for municipalities to be able to meet their new requirement as of July 1st to incorporate equity into their negotiation process with potential applicants and licensees. That is being made public. Again, it is not quite guidance, because guidance is in reference to a regulation, but this will be a document that will provide suggestions for communities to begin to adopt so that they can be in compliance as of July 1st. So I wanted to ask Commissioners Camargo and Stebbins, you know, we took the vote at the last meeting to suspend or to get rid of the requirement that we have, you know, a pilot project in Massachusetts. But I still, because we can't talk, it would be great to get an update, you know, talk to us a little bit about, you know, your road trip, that, you know, getting information, you know, from states where it is, you know, currently, you know, legal. Can you sort of give us and the public a sense of what is happening, what's the work that's being done, you know, and how you know, maybe, I don't know if you have a timeline, but maybe some broad guidance so that people understand, you know, what's happening. Again, I know we're all getting calls, you're probably getting the most of them, but I don't know how to answer, you know, when I get that call. So it'd be great to get some sort of updates since we took the vote at the last meeting.
Sure. I'm happy to start it off and then certainly invite my colleague, Commissioner Camargo. First of all, Madam Chair, as you pointed out, the vote to suspend the pilot program really was a hurdle that we needed to move out of the way so we could really continue to focus on our work. I would say our working group is still doing aggressive outreach. I talked about my opening comments, the survey that has gone out this week, that we want all of the folks who are either in the EE program, the SEP program, are a micro business license or a growing cooperative licensee or applicant to respond to, because right now the regs say those are the eligible applicants for a social consumption license. So that's a deadline at the end of this month to get that survey material back. And again, I'll publicly plead for everybody to open that email. If for some reason you don't think you got one and should have, please let us know. Please reach out to the commission, because your input is extremely, extremely valuable. Secondly, just a general reminder, and I know we have talked about it before, but a general reminder that our working group is not on the same timeline or calendar that the other two working groups are, because they need to comply with the statute and have regulations promulgated and in place by November. However, that does not mean we are slowing down at all. We are also hoping soon to open and publicize 2 listening sessions, public listening sessions, one out in Western Mass and one here in the greater Boston or in the greater Boston area, as well as a virtual opportunity for folks to come in and again, talk to our working group and raise concerns, issues that they have, ideas that they have for the social consumption license type.
Do you have that scheduled?
I believe we have one scheduled for the end of this month, June 27th. I think we're going to be out in Holyoke at Holyoke Community College. Appreciate their willingness to partner with us and host that first listening session. We are also diving into other state regulations as part of our working group's activities. We are also diving into reviewing our existing RDT programs and looking at possible training work that might need to accompany the rollout of a social consumption license type. So lots of work underway. We're still doing outreach. Want to thank the governor's office. They have connected us with the new leadership at DPH. We want to talk to them. We're also trying to get on the calendar for the Mass Chiefs Association, as well as I believe I'm even having the opportunity to speak with all of the designated regional tourism councils around Massachusetts, a group that is particularly interested in this topic as well. So it's full speed ahead with respect to outreach and getting feedback. And again, just a reminder that we are not under those same time constraints that the other 2 working groups are having to comply with. But Commissioner Camargo, I'm not sure if there's anything you want to add or if I missed anything. You're on mute.
Blah, blah. Sorry about that. There's not too much more to add. I will reiterate what you said because I've seen some messages already. If you are in the universe of a social equity applicant, economic empowerment applicant, micro business, or co-op, and you have not received the survey, look in your spam box. And if it's not in your spam box, reach out to us. Whether I think we're using our regular sort of customer service email. And let us know that you have not received it. So that's one thing. And the other thing is we have been working with our communications team and our regulatory team to get out an email. It will go out on Monday as for the listening session. So everyone will see not just an email, a newsletter, social media. So you folks will know what the listening sessions look like, the dates, the times, and the location. So that will be coming out soon. So thank you.
Thank you. And then just finally, the more you can report back, I know people are very eager. And so, you know, the most important thing that I would personally like to see is, I know you're looking at what it is, but it's also, you know, having maybe another communication with the Mass Municipal Association, to say, you know, to say how this may be working. But the sooner you can put a deadline, I think a lot of people, and I know you're working towards that, but.
Of course. Of course.
Okay.
I'd love to be able to, I can give you one deadline right now, which is June 30 to get your survey in. So I'm really looking to that to be, I'm hoping that's a tool for some really substantial input as to license types, things that we need to be concerned about with respect to the regulatory framework. But obviously, the longer our team works on this, it keeps us away from working on a lot of the other regulatory issues that I know we're going to talk about. So we're just as anxious to kind of move the work ahead. And to your point, you know, communities are wondering what next steps are as it relates to social consumption as well.
Okay. All right. Thank you. Thank you both for the work that you're doing. And thanks for the update. Now, any other comments or questions about that? Okay. So one of the things that I had suggested, because we now have 2 groups that are, at least I won't say in the rearview mirror, but the sort of bulk of the two groups that we've been working on is at least initially complete. There are many pressing items that are facing both the industry, patients, consumers. And one of the requests that I've had is, is there low-hanging fruit? That's kind of the sort of term that we've been using. Are there some non-controversial, simple fixes that we can put in place? I don't think it's going to be 50 regulations, but it's maybe a handful that we can put in the hopper, as it will, and ask the staff to help us. What people don't understand is the work that we've been doing on municipal equity, on social, equity, on social consumption. This has required a lot of initial legwork to sort of look at policy and details and getting different stakeholders to be pro or con. Obviously, that's going to be another step that once this is sort of language is finalized and looked at by our staff, when we send it to the Secretary of State's office. But I'm thinking more something that is strike this word, you know what I mean? Something that isn't necessarily going to take broad thinking before we do it, but there is some consensus. And one of the first issues that I was going to raise, and I think that, we're in agreement on this, is the issue of the two driver rule. What I'm hoping to do today is to maybe find a handful of items that we can talk about, determine if we have some consensus on this, again, because we're limited by the open meeting rule, and see if we can provide some guidance to our staff so that we can find some ways to help our industry. We have many businesses that we are seeing under tremendous stress. The price of cannabis has gone down. The inability to, write off your, business expenses on your federal taxes. There are a number of issues that are putting pressure, and we're seeing some businesses, they can't file for bankruptcy. So potentially having to go out of business. So I just wanted to kind of launch this conversation in open meeting. I've asked some different groups to provide us with some thoughts about, again, low-hanging fruit, something that doesn't take field trips or you've got to meet with so many different groups on social consumption to sort of really understand a broad and sort of unwalked upon territory. But this is something that I think we should be able to figure out how we can make some quick fixes. So I just wanted to sort of throw the floor open to any, thoughts that people have. The two driver rule was one of the things that I put in my pile of things that I'd like to see happen. I don't know if there's consensus on that, but, and I almost don't know how to conduct this sort of debate and conversation, but just sort of wanted to get your thoughts on that and to see if maybe we can throw some things out that might be in this sort of tranche that accompanies our municipal regulatory writing that we can then, go through that process with our staff. Go ahead, Commissioner Roy.
Thank you, Madam Chair. I appreciate you bringing this up. And just as of yesterday, many of us got an email from Gibby's Garden, a micro business in Uxbridge. And we talked about this last meeting. Micro businesses are struggling. Many of them are on the cusp of even being able to continue operations. And Commissioner Stebbins and I had a great meeting with the ED and Kyle, Director Potman. And it's not a heavy lift. Again, I had said this last month to assist this license type with some friendlier language, if you will. Striking only allowed to own one license. It could be as quick and easy as striking one line and just adjusting another one. So micro businesses, I'd like to maybe we can tackle that low-hanging fruit.
So I don't know how to, I honestly don't know how to do this because we don't have any one thing in here, and maybe we bring this to our second meeting in June, but I would like us to identify maybe a handful of items and maybe, have conversations, with our legal staff. But I think we kind of understand it's like, we know what it might look like. So
I think first, thank you for having this as an agenda item. In preparation for it, I sort of made my own list. It's not long at all. It's 3 things.
Yeah.
2-to-1 delivery driver, which I think might be an easier lift because we've had this conversation a lot. I think each commissioner has sort of had their own conversation as well.
Can I actually ask, does anybody here because this is something, if we have someone who's vehemently opposed to this, then it, you know what I mean? I mean, we still can push something like that, but I just, if we can find consensus, and I don't know where Commissioner, Camargo stands on that. Is that something that you would support, Commissioner Camargo?
Were you asking the folks in the room first, though? I'm just curious since you guys.
Oh, no,
are
no,
all
I'm
in.
sorry.
Yeah, absolutely, 100%.
And does anybody else, it's really just trying to find consensus
Yeah.
in a legal way.
I would just add, and I've met with many delivery couriers, visited them. Commissioner Stebbins and I went out to see Chris February at Your Green Package and showed me the cars and Chris actually brought this to my, this needs to be not just a 2-to-1, it needs to be a bigger conversation around the manifests when those are due. We need to look at it from a holistic, like other things might need to get tweaked in addition to the 2-to-1. Because so we'll have a listening session for that, right? This is what this process, yeah. So I think we just need to take a look at the entire regulatory scheme around that.
I want to finish before I
Chair.
lose my thoughts. I just want to finish before I lose my thoughts. So the first was that. The second is a conversation around our positive impact plans, what we're allowing, the lack thereof of guidance in our regulations, just to make sure that we are codifying what we're looking for. And so there's no discretion, confusion amongst not only those who are working in the industry, but also our staff here and what's applied. So I think that's important. The third thing, and that's something that I am doing now, is around suitability. I talk about this all the time. It's not a low-hanging fruit, but I'm working on it now. And I've asked and have talked to Michael Baker, Andrew Carter, and our legal team, just to sit down to wrap our minds around this, because although it's not low-hanging fruit, it's timely. We have a deadline. So even though there was no regulatory group, there was still a statutory change to our regulations under Chapter 180.
Now, what deadline, can you clarify that for me?
So November, the deadline for Chapter 180 and the implementation of our new regs in accordance to the law.
Right.
Our regs, our charts right now are not aligned with the new law. So that already has to happen. We have to make these necessary revisions to abide by the law. But there also needs to be an additional look at what our suitability tables say and the fact that now it's not balanced. So people can be employed here, they can work here, they can do all these other things in the industry, but they're banned from ownership. So it's not even. And I know that a lot of our regulations were created from a really cautious standpoint. And I think even when we talk about 2-to-1 delivery drivers, that was because it was an abundance of caution. This is also one of those things where it doesn't necessarily align with the intentions and what the voters had in mind. And I'm seeing and I hear a lot about the implications that those regs have had. So that's the other thing that I think was a good opportunity for me to kind of inform everyone here that that's an ongoing process and we're working on it. That's something that we'll come back and have a more broader conversation, but those are the three. So suitability, positive impact plans, and delivery drivers.
Okay, great. Commissioner Stebbins, did you?
Yeah, thank you, Madam Chair. And again, thanks for putting this topic on the agenda. First of all, I think we need to allow Commissioner Concepcion more car time so she has the time to think about a lot of these things,
The staff are all shaking their heads no.
which is great. Like shorten her commute. Just to touch I like the idea that you've talked about, which is what are those simple changes that positively impact the industry, but again, comply with the Commission's overarching goal of ensuring public health and safety throughout all of our views and how we look at all of our regulations. You know, I do think it is important to have a conversation around the delivery courier license model. I agree that it needs to be a more holistic view of all of those regulations. And, you know, it is somewhat, that issue is somewhat filtered into our working group's conversation around social consumption licenses of what's the point of coming up with a license that at the end of the day is not lucrative to the license holder. I echo Commissioner Roy's comment about our micro businesses, and it's not, you know, there are micro businesses I would guess that are reaching different levels of success in the industry. There are some that are ready to expand. There are some that need to expand. And basically, the way our regs sit now is we're turning off that flow of money so you can go pursue that next license type. And I think that's created an unnecessary a burden for our micro businesses. There are some additional things around consumer education that I'd love to have a conversation about.
Could you, can you get into it here, or what do you think?
Yeah, and this goes back a ways, in terms of what information, we obviously have our extensive and successful More About MJ campaign. I want to go back and look at what our licensees are required to provide when you walk into a dispensary. And I think part of it is just pulling apart what information they need to provide about their products and what information we need to provide about general overall safety with respect to cannabis use. I know Commissioner Roy has also heard this, there's some frustration of some of the language that needs to be a little bit more visible on billboards across the Commonwealth. There are requirements, however, I regularly will get out of my car and call Chief GB and say, I think there's a billboard that isn't in compliance. And so it's not penalizing those billboards, but it's making sure some of the information we want to be seen by potential consumers is visible. And I would also entertain a conversation with, our entire team. We have investigators, investigative managers who are out there every day working with our regs as they go through facilities. I'd really welcome their input to say, if we made this change, this is the impact. So it's a healthy conversation for all 5 of us to have, but I think it's also a healthy conversation where we can engage our team for that low-hanging fruit, some of those simple changes that, again, safeguard public health and safety, but may provide a little bit of relief to our licensees, especially as this market is getting so much more competitive.
Commissioner Roy and then Commissioner Camargo.
Something I've talked about a couple meetings ago, and I continue to talk about publicly, and it's not low-hanging fruit, it's labs. At some point, I'd like to have a discussion about codifying what potency is and how do we determine potency, standardization of labs, data transparency on our open data platform, adding terpenes to labeling, QR codes, and how the difference, there's no standard, so how pesticides, microbials, potency is reported out. There's huge variables. So many folks, labs included, have called for more regulation around labs. So we have standardization and what is potency. So,
But that's the kind of a thing that we're going to need a working group.
absolutely, this was a big one.
Yeah.
This is a big one.
It's a big one.
Yeah,
But it's one that we're sensitive to. And
yeah, and discounts is the other. How we
that?
enforce discount. Right now in the regs, medical program, MTCs can discount and adult use, but it's happening. So we need to make a declarative statement around discounts at some point.
But is that an easy one to do?
I don't know. What do you think, Commissioner?
Isn't this fun?
It is.
Yeah.
I know. This is Jeopardy, like on the spot, but I don't know. It could be hard. It could be easy. I don't know, or somewhere in between, but I just wanted to throw it out there.
Okay. Commissioner Camargo, do you have some thoughts or some ideas where you might find us some low hanging fruit that we could, she's got a whole
she's
tree.
got
That
a
was
list.
a whole tree.
It's got a list.
Okay.
I feel like it's Christmas, Chair O'Brien. Thank you for bringing Christmas in June. No, so a couple of things. One is, Chair O'Brien, you talked earlier, like, well, how do we do this? Like, how do we do this? And you brought it up to the agenda. So thank you. I think we have to think about exactly what you said. It's the low hanging fruit, right? I'm thinking about this operationally and in buckets. So it's sort of like, what's the low hanging fruit? It sounded like you were taking the temperature on us in terms of the 2-driver rule. It sounds to me like we could probably take a vote on it today. I'm not saying we are, but it sounds like by the temperature, I think everyone is in the same, in agreement that we need to change this. So that's just sort of, I'm thinking in buckets, sort of the low hanging fruit, sort of like the middle bucket, things that will need a little bit of more time. And then the third bucket, things that are a little bit more difficult. So, and I'm saying those comments because you had asked sort of like, how do we do this? So I'm just thinking operationally, because I know you want to see things change, and you're leading this conversation. So I'm just thinking about what is low hanging fruit for real, right? So a couple of things that I was just thinking about was, we have a December deadline right now with curbside pickup and, those other 2-3 things that we have on that list. Should we put that on the low hanging fruit? I think all of us are, I think by now, maybe on the same page or have 3 votes for some of those things. Do we put that in the low hanging fruit bucket, right? Or are we going to wait till December to sort of have that conversation? So those are a couple of things. In terms of the delivery, the courier and operator license, the 2-driver rule is one component, but then there's other things to it. And Commissioner Roy, you alluded to it, and Commissioner Concepcion and I have been having this conversation, her and I, just around delivering to the no towns, right? How do we eliminate delivering to no towns? We understand that the towns have voted no, but how do we eliminate that? How do we eliminate delivering to hotels? We talk about the tourism in Massachusetts and sort of making sure that we are, welcoming that, but how do we then deliver to folks that may be at Airbnbs or, or hotel, not Airbnbs, but just hotels. So that's something up there. The other piece of it too, and I've heard a lot about this. I don't know, Commissioner Roy or Commissioner Stebbins, if you guys heard a little bit about this, but the insurance that these couriers need and the pricing for it as it pertains to them being sort of non-plant touching, right? That's another situation that's sort of sitting there. Also, I think that we're very focused on eliminating the 2-driver rule, but some companies may want to have the option to have 2 drivers. So not, really us allowing delivery companies, if you want to have 1 driver, great, but if you want to have the option to have 2, that's on you, right? And then I would say, I've been looking at internally, and Commissioner Stebbins and I have been talking about this, is the renewal process. I know that Chief GB and Sean Collins, Kyle, we've been talking about this for a while now. How do we streamline the renewal process internally? Because every month we have, 100, 160 renewals that, a lot of us read through, we sort of examine. So I would be curious to get staff's sort of input around the renewal process and what that means. Commissioner Concepcion and I are looking at suitability, something we've been talking about, and Commissioner Concepcion invited me to that conversation, so I appreciate that. The other thing and this is not as much of a low-hanging fruit, so I would put it probably in the middle bucket, but our economic empowerment program. So what is it, 5 years in? We call economic empowerment applicants. We still use that terminology. They're no longer applicants. A lot of them are licensees, right? So even thinking about the terminology and how we use it, but also what's the graduation phase for the economic empowerment folks. Also, when it comes to control issues, ownership issues. So I would definitely like to look at that. And I had the hardship program. I know we're working on it. Outdoor testing is something, again, that's probably the 3rd bucket. And then also, let me see, one more thing. I have a few things, but I won't put it all. Oh, yeah. Definitely would like to look at 3rd-party transporters and sort of clarifying some stuff in 3rd-party transporters and looking at that license as well is something that I would be really interested in. Again, I don't know what bucket it goes into. And then my last more significant, difficult would be cultivation and thinking about licensing caps and what does it look like. I know that next month, Sean is going to report out in terms of how many social equity applicants or economic empowerment applicants are within the cultivation queue. So again, I don't think that's a low hanging fruit, but since we're having the conversation, I just sort of put it out there. So Madam Chair, I think you have a hard task of figuring out low hanging fruit. So I'll leave it at that. So thank you.
This is it's healthy for us to have this conversation and we'll frankly look to our staff to determine what level of the tree the fruit is on.
Yeah,
And what
exactly.
type of, but anyway, thank you, Commissioner
So
Concepcion.
I just wanted to add one thing. Commissioner Camargo, you jogged my memory around the conversation that we had with the delivery licensees. And I know that this is coming up anyways because our regs require it, but we have to have a conversation about the exclusivity period as
Yes,
well.
yeah.
And I think that, you know, when we talk about certain license types, delivery licensees, social consumption, we have to also talk about sort of the exclusivity period where it stands
Absolutely.
now and whether or not it should be extended.
The topic,
Absolutely.
the topic that I had wanted to put on our agenda for the next meeting is equity.
Okay.
And kind of, what does it look like? What do we have to do? Measuring success, measuring impact. I'd like us to launch that sort of deeper 5 years in. We're going from startup to, you know, maintenance, and that is, and we can have, that can touch on a lot of things, but that also can, you know, color some of the things that we might want to put into that.
I think that's an excellent idea.
Okay.
Yeah,
So,
that's great.
Madam Chair, yeah,
please.
if I may, yeah, just operationally, I know you have a lot of work to do now with this sort of conversation and topic, but I guess I would just, if you need help thinking through operationally how to operationalize this conversation, let me know. I'm happy to work with you because I think that, you know, last year we went through our regulatory topics. We've submitted them. All of us submitted stuff to our general counsel, the team, legal. You know, there's a whole process that's already sort of been in place for topics. So I'm just curious how we're going to now sort of operationalize what is low hanging fruit. And then you're saying that you may want to have a conversation about equity. So I'm wondering if those are two different conversations, right? Like the low hanging fruit and then the equity, but also equity is the umbrella, right, of what a lot of what we do in the mission at the commission. So I would just sort of, you know, I would ask you to sort of think how we're going to have that conversation. And the only reason I'm saying that, Madam Chair, is because we can get messy sometimes, and sort of get out of, you know, sorry.
My middle name.
I'm gonna be honest. I gotta be honest and transparent. We get messy sometimes. So, you know, so trying to really understand and operationalize the process and using our legal team, using our, you know, using some of the process that we already have in place so that we can have fruitful conversation around low hanging fruit and also sort of like what you're talking about in terms of an equity umbrella, because I think that we are here right now. And I think that all of us want to move things forward. And this is such a great time at the commission for us to be able to move some of those low hanging fruits. I mean, Commissioner Roy, today's step was huge, right, in terms of the legislation. So how do we continue to do that? And again, we're not going to always agree on things. This commission, you need 3 votes and then you keep it moving, right? So if you need help with that, I'm happy to think that through, process the operation, and I'm looking forward to the conversations.
Thank you. And if I can just, you know, sort of publicize, you know, I had, when we put together our original list, and again, this is also the sort of problem with the open meeting rule, is that I actually asked, you know, Mike Baker to give me the list of what we had thrown into the hopper last year. And it has to be depersonalized. I literally can't see who said it, and because that violates open meeting law. So this is just, you know, the 126 attendees feel our pain. And I guess there are more that, you know, kind of, you know, echo, you know, with different people who access this feed. But, you know, I'm particularly concerned and have heard about the micro business rule. I agree on micro business. You know, one of the issues that I wanted to raise, and I've had a conversation with Alyssa Stack, our COO, but it is making the plastic medical cards optional. Anybody who wants one of those cards should be able to get them. And there are certain existing sort of cultural issues as to why someone might want that piece of plastic when they're driving, you know, through their neighborhood. And they want that quickly to be able to show someone. That being said, it's a tremendous expense to the commission. Some people, you know, some of the biggest complaints I get are, where the heck is my card? And, you know, I think A, it's something that we can save money on, but B, if someone wants that plastic card, they can have that plastic card. Go ahead.
Along, you jog my memory, along those lines, and I know Commissioner Steph has been really great, and I've met with them, the Sustainability Coalition. And Sean had mentioned Metric is, I think, either developing or developing hemp hemp-derived metric tags that are probably like biodegradable metric tags. So at some point, I'd like to explore that a little further about these hemp-based metric tags and along those lines with plastic.
That is very good. And then some of the other things, again, I think this is like the lowest hanging fruit we can get, is that we require nurse practitioners to consult with a doctor before they can prescribe medical cannabis. It's nuts. They can prescribe oxycodone without going to a doctor. So, to me, that is almost the essence of low hanging fruit that we just need to say they don't have to report to a doctor. Some of the other things that have been raised with me is getting rid of these structural change fees that maybe, we are putting an undue burden on our licensees. Another issue that had been brought to my attention that, again, I would like to get staff to weigh in on something like this as to whether or not it's low or higher up on the tree, is multiple badges. When you have entities that have multiple licenses, this is an expense that is on our industry, and may or may not make a lot of sense. And so I think that, and this is why I look at the issue of the medical card. We can actually save some money that then could be deployed, in other places where we are taking, a fee or a cost off of businesses. So that being said, okay, I would like all of us to, oh, go ahead.
You just jogged something. Oh, because I've had this conversation so many times, but I have not said
But
it
you can't
here.
remember who you said it to.
So, because you're mentioning cards, agent registration cards, I think we need to have a conversation. I want to have a conversation about the way, I would like us to sort of see if we can align that with the individual as opposed to the entity. Because right now, it comes at a cost for our licensees to give these cards for the agents, for the people who are employed there. And also it would allow the employees to sort of use that same registration.
By leverage, exactly.
So that is a lower, when you said low hanging fruit cards, you just jogged. I've had this conversation so many times, but I want to share that with all of us, that that's something.
So,
Can I-
oh,
Madam
go
Chair.
ahead, Commissioner Camargo.
Sorry. I thank you. I was just gonna say, I know we're talking low hanging fruit, and I'm, of course, we're gonna have conversation with our team in terms of all this stuff looks like, right? If it's even possible on some of these things, but also I just thought about, as a sitting treasurer, I'm thinking about cost. So just thinking about, what are the impacts on some of these things internally, externally, to make things more feasible for folks in the industry as well. So just wanted to make that quick thought.
Thank you. And so it's sort of like, I don't know what we're doing now, but what I think we all can do, and I have been receiving, from different stakeholders, ideas, some of them, I'm very clear that it's got to be low hanging fruit because we still have to get through this municipal stuff. We still are understaffed in our legal department and we need to rectify that. That's being rectified. But we also need to make sure that, people are focusing on the most central part of our mission. But if we can really think about what low hanging fruit is, like the nurse practitioner thing, that's easy. You know what I mean? So how do we do that? It's a broader conversation, maybe about true driver, but what I'd like every commissioner to do is come up with your sort of list of your best 5 ideas. You don't have to have 5, but if you can keep it to 5 and then we can give it to the staff to tell us whether or not, just how simple it really is. Because I'd love to throw this into the process where when we go out and we have hearings, we can be getting feedback that allows us to then move this forward. A lot of the bigger issues, it doesn't mean, for instance, the bigger conversation about what is social equity, what is the impact, how can we do that? That's a bigger conversation that's going to take place, over time and, maybe a working group that we create. And there may be coming out of here, if you have some ideas now that we've been able to share, maybe some thoughts about let us create a working group on, maybe we just do the 2 driver rule, but maybe we also create a working group to look at something like that. And also, and we haven't really, I haven't talked about this much, but we also have, my husband knows I'm in the middle of a meeting, doesn't he? But anyway, it's, but But, are there other working groups that we, can and should be putting together right now? So I'd like your list of 4 to 5 low-hanging fruit, what you think is low-hanging fruit. And then if you have some other ideas for working groups, then we can bring that back in a couple of weeks and then maybe get some votes and get some things moved. Okay, but
Yeah, no, I just want to add, I like that approach. Again, and I think you put the caveat on it this way, Chair, that our team needs to be involved. And again, I would also encourage us to think through what might have been on their list that again is kind of from that,
whose list? Our staff?
the staff list.
Oh, okay,
Yeah.
okay, yeah.
And again, I really invite our investigators, our entire team that are out there working with these regulations every day to get their input, because they might be able to add to that low-hanging fruit list. But something you all said jogged my mind, again, as you were putting things into longer-term buckets, and I just want to put this out there as a longer-term bucket idea. I have an interest in really exploring where the host community agreement piece of the process comes into play. I've always looked at the provisional license phase as something that we want to know who you are. Do you understand our procedures? I think there's a way for us to do that without requiring that individual to have a host community agreement in place, be paying rent on a piece of property while we're just trying to figure out who they are. So again, that's bucket way down the line, but something I want to explore.
I think it's something that we could maybe later on, in the summer, we can actually talk about that because we're saying no to a lot of different things about having to have the piece of property. But if you're going to have a host community agreement, a community needs to know because it's also part of a special permit process.
Right.
And so if we, in essence, this would be like pre-certification for all entrepreneurs, that's kind of what and that may or may not be a longer term.
Yeah. No, it's a good conversation.
So because Commissioner Roy and I are in the host community agreement working group, that idea did come up. I think I see Kyle here, so I don't see his face, but he's really good at explaining this as well, but that there's a statutory element to this that sort of restricts what we can do.
Could we maybe get Kyle? Because I think this,
There he is.
This is our opportunity.
I know.
Kyle.
Good afternoon, Commissioners, Madam Chair. Commissioner Concepcion, I don't know how much you want to go into detail about this, but I guess, is there a specific question you want me to ask, or do you want me to just talk about that element
If
generally?
you could just give us an overview on why, so we're in an open meeting right now, so we can sort of disclose that we have not gone in that direction, but can you sort of share why and the sort of the limitations that are within statute that limit when an HCA is required?
And we did bring it up, and we did talk about sliding it in okay, Kyle, floor is all yours.
Thank you. And not knowing the particular sections, even though I'm an attorney, I'm not going to be able to cite it off the top of my head ad hoc right now, but generally speaking, yes, the host community working group did discuss this, Commissioner Stebbins, about the ability of moving that host community agreement requirement to a later stage in the licensing process. Based on our discussions, based on input from various members of the working group and legal staff, it seems relatively clear that there is a statutory requirement stemming from Chapter 180 of the Acts of 2022 that does in fact require the host community agreement to be submitted as part of the initial application for licensure, which would essentially at this point, based on the recommendations from that working group, would essentially replace that HCA certification paper form, but would require the actual agreement to be considered and vetted and ensure compliance with Chapter 180 in that initial application. So as of right now, the working group, while we did discuss it, the working group's recommendation was not to move it because we don't think that there is authority to do so.
Okay.
But,
Well, and
okay.
if I can, I caught up with you a lot this week, Kyle, so I appreciate all your time. And again, if my colleagues hadn't jogged my brain a little bit, I probably would have raised this question with you beforehand, but I appreciate that insight.
But if I can just also note to our multiple lawyers, and that's Giancola, we have the cannabis committee in the House and Senate. You know, they just had some hearing the other day about testing and some different items. You know, this is also something that maybe we need to have a conversation with some of the folks, you know, with Representative Donahue. Senator Gomez is, you know, coming back from his health issues and should be, I think, you know, back in the saddle fairly soon. But there may be an opportunity for them to, as some of those bills are going through, and you were a better lawyer, legislative person about that process, but is there an opportunity for us now to be looking at some of the bills that are going through the committee and maybe suggest some options that maybe they can do? Because I think we have a tendency to go, oh my God, it's in statute, so we can't do anything.
Oh, I don't think that.
No, I don't either, but I
Clearly.
think that, I don't think that we leverage the legislative process as much as we can and should be.
Mhm.
And so, you know, that may be a conversation that you guys maybe could have, you know, with some of the attorneys to say, and make a recommendation, like, you guys might want to tweak this, and there may
Yeah.
be some vehicles in there that the language would be consistent and wouldn't be outside the scope of the bill that, you know, would work.
I'll tell you, your mindset is exactly how I thought when I came onto the commission. And the reason for developing a strategy, because we were not utilizing our voice in speaking with, you know, the State House. But this is something that regardless of if there are any bills, I'm sure there are bills that might be moving around there. But maybe, and I don't know who would want to sponsor it amongst us, that is the next policy, you know, recommendation or consideration we have for our legislative and executive outreach. You know, so we sort of frame it, we talk about the fact that this is something that we think is important, that we support, and then use that to kind of convey that message to, as a collective, as a commission.
And I've been out of the legislature so long, I literally don't know the sort of legislative calendar anymore and how all that works. So I'm still a little bit ignorant on that stuff, but you know, we might want to.
And maybe that's Commissioner Stebbins. I don't know if that's something that, you know, it's we can talk about it. You know,
Yeah.
if you want to sort of formulate something and we bring it to the collective and sort of think of a process to go forward.
Yeah, and again, I don't look at this as in that low hanging fruit
No.
category, but something I think that is the industry continues to move along, that we work with our team to figure out if there's an effort worthwhile pursuing to change the statute, but.
Okay. Commissioner Camargo, I couldn't tell if you were raising your hand or.
No, I would just, no, I'm grateful for the conversation. My head is always thinking operationally and process and next steps. So just, you know, kind of sort of getting some next steps from you in terms of, you know, how do you envision this and how do we operationalize it, but also not dismiss the work that we've already done with the regulatory process and some of the items that we've submitted, but then also checking in with staff to understand what, you know, like, okay, my list may be low hanging fruit because I think it's low hanging fruit, but staff may say, yeah, Commissioner Camargo, that is not low hanging fruit. So maybe just a little bit of guidance from you in terms of that. How do you want to do it?
Yeah. So the guidance is I'd ask all the commissioners to share with Mike Baker your 4 to 5 things that you think are low hanging fruit. If you also want to say, I know this is not low hanging, but maybe we need a working group on this, I just ask that you provide that because, and you know, all of the people who are listening don't know, we put this in place last year, right? And so now that we're sort of at least at an inflection point where we've gotten a significant piece of work done to rewrite regs for municipal equity and for host community agreements, and we're now going to be, you know, moving into that process. You know, whatever we can do quickly is good. If it's not quick, you know, maybe people just want to raise that so that we all know what other people are thinking without sort of violating any sort of open meeting law. So
I want to make a comment to clarify something as well. I brought up suitability. And I just want to make it very clear that we're not seeking to create a working group for that. I think that, you know, with the legal team, myself, Commissioner Camargo, I believe we'll be able to sort of hash this out and bring something to the full commission without requiring more staff. So I just want to put that out there to clarify that.
All right,
Um,
so.
I just have another piece of possible low-hanging fruit. And I understand why it was put in place, when it was put in place. It's that 72-hour rule. Sean always sends us commence operations. And there's a 72-hour rule, and it was put in place because if you remember, when the first two opened, the lines were miles long and around the block. So that was truly needed, right, for police details or for traffic control. But that's not happening now.
That is about as low as it gets.
So I think that's super duper low-hanging
It
fruit.
is.
Okay.
Okay, Andrew's laughing at me. Anyway.
We
so.
should get t-shirts. We should get t-shirts that say low hanging fruit at the CCC.
All right, so a good conversation. I appreciate everybody. The staff is going like, they were all like cheering how short this meeting was going to be, but now you realize what we've been able to accomplish in that last half hour is going to make you all miserable. So anyway, good on that. So anyway, are there any other, so are we done with that conversation? Everybody good? Okay.
And
Yes.
you want that the 5 by when?
Let's, a week from today. Okay. Is that good? Okay. I mean, sooner rather than later, because today's a Thursday. Actually, how about next Wednesday? Okay, then that actually gives us 2 days to kind of maybe think about this, maybe fold in to whatever we're going to be sending to the Secretary of State's office for the municipal stuff. Okay, does that make sense? Okay.
Chair, I'm sorry. Can I ask for a few more days? I'm just thinking, I think there's a lot on the plate and I don't know, maybe everybody has their list, but maybe Friday of next week. Is that okay to people?
How about this? I'm going to encourage people to do it by Wednesday. It's really,
Okay.
you know what I mean? I just,
Okay,
only because the more we push up the deadlines, the
That's fine.
less likely it is that we
Okay.
can sort of efficiently use the time and fold this in with the, you know, some of the hearings that we might have. So whatever you have, get it to us by Wednesday. If you have additional ideas, it doesn't preclude them from being
Okay.
included, but I only added that day just because I would love to sort of have an understanding sooner rather than later of what's on the list, what's not on the list, and where we can get some consensus. And then remember, we're going to have another meeting at the, I don't know if I have the date on my thing here. You know, we're going to be having our
26th.
second June meeting, and I would like to have that pretty well figured out before then. So my apologies, but I think that that's going to work the best.
I'm sorry, Chair, just for clarification. So is the expectation that we turn in our list on Wednesday or right there? And then our team will let us know what they think, whether that's low hanging fruit or not, or
Yeah.
that's for,
Yeah.
okay,
Yeah,
got it.
that's what I'm saying is that come up
Okay.
with your idea.
Okay.
And then let's share that with them. I mean, again, just a small handful. It'd be great that we can see, you know, if there's overlap, if there's not overlap. But then we're gonna let them help us understand how that impacts them.
Okay. Thank you for the clarification.
Okay, are there any further comments and questions? Any new business not anticipated at time of posting? Hearing none. The next meeting date, I'm not seeing, do we know? Is it on this?
There it is.
There it is, okay. June 26th, 2023. This will be our opportunity to talk about some additional issues, maybe hone this a little bit, and the agenda will be coming out shortly. But again, I want to thank everybody. Excited that we're getting out so early today, and appreciate the robust conversation with everybody.
Can I
ahead.
I just want to point something out because we get this question every year, but for everybody, including our licensees, notice there is a meeting currently scheduled for December. We often hear a lot, is there going to be a meeting in December? Do I need to get my stuff in by that time? So it's good that we're making everybody aware of it.
Yes, okay, thank you. Okay,
Motion to adjourn.
please, any second?
Second.
All right. No comments, questions, hearing none. I'll take a call of the roll. Commissioner Camargo,
Aye.
Commissioner Concepcion. Aye. Commissioner Roy, Aye. Commissioner Stebbins?
Aye.
Chair O'Brien votes aye, 5 in favor, none opposed. And again, thank you to staff and again, Stephen, thank you very much for
Thank you,
bringing
Steve.
this to our attention. We
And
appreciate
Stephen,
it.
make sure you get that letter as well.
Thank
Being a stakeholder.
Thank you.
Thank you. Okay.